Hi, my name is Dr. Andrews. I'm an audiologist and senior user experience consultant with Cearvol. We're talking about all things hearing loss and hearing aids, and today's topic is getting started with your hearing aids. Congratulations, you've got your hearing aids, you've opened the box, and it's time to get to know them. So what is the first thing that you're going to do? If you said read the instructions, you are correct. It sounds boring, but even as an audiologist, I've been working with hearing aids for years, and every time I pull out a new set of hearing aids that I've never used before, the first thing I do is read the instruction manual cover to cover. Every hearing aid is different, all the parts are different, all the cleaning instructions are different, all the program features are different, and it's important to get to know your hearing aid inside and out. You guys are going to be friends for a long time. If you don't do anything else, please read the cleaning instructions. The number one reason I get for repairs and replacements of hearing aids, doesn't matter what make or model we're talking about, it's that they're not being cleaned regularly or they're not being cleaned properly. So know where the parts of your hearing aid are. You're probably going to need to clean the microphone and the speaker with a brush. If they're rechargeable, you need to keep the battery contacts clean on the hearing aid. And in the case, if you have batteries, you need to know when to replace the batteries. If you have extra parts like wax guards and domes, you need to know how and when to replace those as well. That's going to give your hearing aid the best lifespan, is cleaning them on a regular basis. Another thing you want to look for in the instructions is proper insertion. You think it'd be really easy to put a hearing aid in your ear, but it can be a little tricky depending on the hearing aid. You want to make sure that it's fitting properly because poor fit can lead to a lot of issues with sound quality and feedback, which is whistling or squealing of the hearing aids that you've probably heard about. It needs to fit properly. It needs to have a good seal in your ear. So look at your instruction manual, look at the images and the pictures to make sure that you are inserting the hearing aid properly. If it goes all the way in your ear, it needs to be all the way inside your ear canal. If it fits behind your ear, you need to know what position it needs to be there. Look at the instructions for that and make sure that it's inserted properly, especially if you're having sound quality issues. The other thing we want to look for in the instructions is the hearing aid features. So the program features, and if you have an app, the app features. So with OTC hearing aids, it's going to require a little bit of setup. Do you have preset settings that you choose from, or can you take a hearing assessment in the app or input your hearing test into the app to program the hearing aids? What is the best way to set it up? What are the best programs to use? What environments do you need to use different programs in? These are all things that you need to look at. If you're going the prescription or traditional route, you'll have a hearing provider there that can set up a lot of the programming for you and ask them about the different features. Think about situations that are still difficult for you, like listening in noise or listening to the TV, things that you specifically want help with, and look for those programs to help you in those environments. Okay, you've read the instructions, you're ready to go. We put the hearing aids in for the first time. What happens? Well, for some people, it's super easy. They put them in, they're crystal clear, everything's what they expected, and they're ready to go from day one. For other people, most people actually, it's going to be a little bit more of an adjustment. So let's talk about it. The thing about hearing aids, unfortunately, is that they don't restore natural hearing. So this is a tool. It's artificial hearing. You're listening through a microphone and a speaker, and you're still listening through a damaged auditory system. So it's going to take some time to get used to. So probably the first thing that you'll hear are sounds in your environment. You might hear the air conditioner running, you might hear the dog running across the floor, you might hear your clothes rustling or even clocks ticking, things that you really wouldn't expect to hear. The thing is, people who have normal hearing can hear those things too. If you point these things out to someone who has normal hearing, they may be like, oh yeah, I can hear that too, but they weren't paying attention to it because your brain can filter this stuff out. You will get to that point. It takes time. But right now, your brain is really distracted by all the new sounds that it's hearing. So that's the first thing that you're going to notice. So once you start learning how to hear all these environmental sounds again, and your brain starts to figure out what's important to listen to and what's not so important to listen to, it's going to start focusing on things that you want to hear, like speech. So speech is a very complicated sound. We don't really think about it, but it takes a lot of processing power. We're listening across a lot of different frequencies. We're picking up a lot of different sounds, maybe sounds that you haven't heard in a long time, like those little consonant sounds that make everyone sound like they're mumbling. So your brain is going to learn how to pick those up. It's going to learn how to process it and sort through all that speech again. Again, we're listening with artificial hearing through a damaged auditory system. It's going to take some time, but consistency is key. The more you wear it, the faster you'll get used to it and the easier it's going to be. We'll keep digging deeper into these topics as time goes on, but I hope this was helpful. If it is, please stick around. We've got more videos on the way.